Hi guys, today we will be presenting to you on a type of xenobiotic drug which is known as the psilocybin.
So we will be covering the introduction, the properties and function of psilocybin together with its history. Next, we will be covering on the effects on body together with the pharmacodynamics and kinetics of it, including a few examples of real-life cases where psilocybin is used. Last but not least, we are also covering the precaution and risk while handling psilocybin.
So let's begin with what is psilocybin. So psilocybin is classified as a psychedelic drug under hallucinogen, which will make you hallucinate and forget about what happens in real life, and you tend to imagine and see things that are not in reality. And it is found in over 200 species of mushrooms, especially the psilocybe genus. It is generally known as the magic mushroom or shrooms. For example, we have the COMP360 psilocybin drug, which is developed by the Compass Pathway, and it is currently under the third clinical trial stage. For your information, the psilocybin is banned to the general public, but accessible by licensed authority only.
Okay, so first, I'll start with the chemical structure of the psilocybins, which are C12, H17N2O4P. It is also known as 4-phosphoryldeoxy-NN dimethyltryptamine, or short is 4-PO-DMT. Its IUPAC name are 3,2-dimethylamino ethyl H-indo 4-il dihydrogen phosphate. It is also known as a prodrug of psilocybins. It has hallucinogenic properties.
Psilocybin's story begins over 1,000 years ago in Mesoamerica. Indigenous cultures like the Aztecs and Mazatecs use psilocybin mushrooms, called tionanacatl or flesh of the gods, in healing rituals, spiritual ceremonies, and rites of passage. These practices were deeply embedded in their cosmology and were guided by shamans known as curandera. After the Spanish conquest in the 16th century, Catholic missionaries banned these rituals, calling them pagan and demonic. The sacred mushrooms were pushed underground, surviving only in remote communities such as the Mazatecs of Oaxaca, Mexico. Fast forward to 1955, when American banker and ethnomycologist R. Gordon Wasson and his wife Valentina participated in a mushroom ceremony led by Mazatec curandera Maria Sabina. Their experience reignited Western interest, leading to the isolation and synthesis of psilocybin by Swiss chemist Albert Hofmann, who also discovered LSD. In the 1960s, psilocybin spread through counterculture movements and became a symbol of the psychedelic revolution. The Harvard Psilocybin Project, led by Timothy Leary and Richard Alpert, tested its therapeutic and spiritual potential, but also sparked controversy. This wave ended with psilocybin's classification as a Schedule I drug in the 1970s, halting nearly all research. But in 2006, a landmark Johns Hopkins University study revived interest by showing that psilocybin could induce profound and meaningful experiences. This paved the way for modern clinical trials, and in 2018, the FDA granted it Breakthrough Therapy designation for treatment-resistant depression, expediting clinical trials.
First, absorption. This is simply how a substance gets from where it is administered into your bloodstream. Oral administration via capsule is the most common, but other routes such as intravenous, transdermal patches, or inhalation. These alternative methods are often used to bypass first-pass metabolism in the liver for faster effect onset, but can reduce the drug's effectiveness. It is absorbed mainly in the large intestine. 1. Absorb. We move to distribution. This is how the substance spreads throughout your body, reaching its target area. Psilocybin has a plasma protein binding rate of 70 to 80%, meaning a large portion of psilocybin attaches to blood protein, affecting its availability. It has also a moderate volume of distribution, showing it disperses well. Crucially, psilocybin can pass through the blood-brain barrier effectively. This allows it to reach and target tissues in the central nervous system, specifically the prefrontal cortex for thinking, the amygdala for emotions, and the default mode network involved in self-reflection. Its ability to get to these specific brain areas is the key to its effect.
Next up, we have the metabolism of the psilocybin in the human body, where psilocybin is dysphosphorylated into psilocin in the liver and in the blood with the help of alkaline phosphatase enzyme. In addition to it, Inactive aldehydes are formed in the brain and liver when psilocybin undergoes oxidative metabolism. Next up is excretion. As we know, all the drug that enters a human body have to be excreted. This includes psilocybin. So psilocybin is excreted via urine after being filtered by the kidneys, and it is mostly cleared at 24 hours, being virtually untraceable at 72 hours.
Let's now take a look at how psilocybin works in the body and brain. Pharmacokinetically, after oral ingestion, psilocybin is converted into its active form, which is psilocin. Psilocin levels in the blood peak at about 10 to 20 nanograms per milliliter within 1.5 to 2 hours. The effects typically begin around 20 to 40 minutes after ingestions and can last between 4 to 8 hours. Psilocybin itself has a short half-life, about 30 minutes, while psilocin lasts around 2.5 hours. Pharmacodynamically, psilocin acts as a partial non-selective agonist at several serotonin receptors, mainly 5-HT2A, which is responsible for the altered mood, perception, and connection. Activation of 5-HT1A helps to regulate mood, while 5-HT2C modulates dopamine and norepinephrine pathways. In the brain, psilocin enhances neural plasticity and increases connectivity between brain regions that are usually isolated. This helps patients break rigid negative thoughts patterns and reinterpret past experiences in a healthier way. Therapeutically, this results in greater emotional openness and reduced fear responses, making psychotherapy significantly more effective.
Let's talk about real-life cases. Firstly, psilocybin can use to cure cancer-related anxiety and depression. This experiment is a double-blind crossover trial. A single with moderate to high dosage of psilocybin is used for psychotherapy and given for terminal cancer patients with end-of-life distress. Psilocybin shows rapid and substantial reduction in anxiety and depression lasting over 6 months. And this experiment report increased spiritual well-being and death acceptance for cancer patients. Secondly, we talk about treatment-resistant depression, also known as TRD experiment. This is a randomized control trial. Total of 233 participants involved in this TRD experiment. They are given 1 mg, 10 mg, and 25 mg of COMP 360 psilocybin drug. Surprisingly, 25 mg group had significant and rapid reduction in depression scores compared to 1 mg and 10 mg groups. Then, some of the participants were able to maintain remission for weeks, even up to few months. Importantly, this TRD experiment has mild side effects, which is considered normal because still under clinical trials.
Hi, I'm Kenzo. Now I'll briefly talk about the precautions and risks of psilocybin. In medical settings, psilocybin must be given in precise doses after psychiatric screening. Trained medical staff must monitor the session. Therapy before and after may help to support the patient and evaluate the effects. But there are also some serious risks. Psychologically, it will cause anxiety, paranoia, or even psychosis. Physically, it may lead to nausea, dizziness, and poor judgment. Long-term effects are included lasting changes in mood, or a rare condition called HPPD, where visual disturbance persists. It's also illegal in many places, and outside of clinical use, there's a risk of poisoning from wild mushrooms or unsafe behavior. So while psilocybin has potential benefits, it needs to use very carefully under strict supervision.
Psilocybin works by acting on serotonin receptors in the brain, enhancing neuroplasticity and breaking rigid thought patterns, often in just 1 or 2 sessions. Its effects are profound: emotional openness, reduced fear, and long-lasting relief from depression and anxiety. But despite its promises, psilocybin remains a Schedule 1 substance, legally restricted in most parts of the world. As research advances and public perception shifts, we may be on the verge of transforming this ancient compound into a powerful regulated tool for modern mental health care.